In 1984, when the ICJ was working for the first time on the Siracusa principles, the challenge really to the human rights framework was states of emergencies that we'd seen in the 1970s and 1980s. These basic principles that government responses to any crisis have to be necessary, they have to be proportional, they have to be lawful, non-discriminatory, and restricted in time and space. These concepts have now been incorporated into customary international law. One area where state responses to crises has not been properly developed has been responses to public health emergencies. And the COVID-19 crisis put that front and center.
The fear and what it was like early on with hospitals overwhelmed, morgues, bodies being burned in different parts of the world.
States had immense power. Almost overnight, so states could arbitrarily decide that people stayed in, and they, as the executive part of governments, could make determinations which ordinarily they couldn't make.
The fallback for most governments and for ours as well was public order. The Public Order Act, the public order regulations, which resulted in policing the pandemic.
But even within countries, what we saw is that it was the poor, the disadvantaged, the marginalized who suffered disproportionately. People whose rights were already not being respected were most at risk of suffering from COVID.
The world that COVID struck was one of profound socioeconomic inequality, where we had dramatically underfunded health systems, where we had capitulated greatly to private transnational interests, including pharmaceutical monopolies. And there was a gross imbalance in the global order between the North and the South.
I think human rights have been one of the victims. People have lost jobs, children out of school. So that I think has been a collective failure, frankly, in protecting human rights at the times of crisis.
COVID-19 came to us in a way that we were never prepared in terms of human rights standards. We were not prepared to apply human rights in public health emergencies the way we've seen today, not in such a large scale. So in terms of precedents and legal reasoning, it's guidance for what to do. It caught many states off guard.
Very quickly, global health law was, the IHR of 2005 was somewhat marginalized. International human rights law was also marginalized, where states didn't notify derogations, where limitations were done without legal sanction, without the rule of law. And other actions were done that were wildly inconsistent with even kind of basic, well-enshrined principles in human rights.
International law failed us spectacularly during the COVID-19 pandemic. I'll take one example, being that of access to vaccines. You had a proposal by India and South Africa to allow for greater access to things like testing, to vaccines, to treatment. And instead of responding in sort of a timely fashion and a substantive fashion to address that demand, international institutions instead stalled in terms of making a decision. And then when they finally made a decision, that decision was wholly inadequate in terms of responding to the need.
Although governments had thought about how they might respond and how human rights might require them to respond in the context of other emergencies, very little thought had been put into thinking about them in the context of public health emergencies. And on the other side, public health experts and global health experts hadn't really thought about the practical day-to-day business of governing during a pandemic. And so we all really were having to work out how to deal with this and change the tire while the car was still moving.
What the ICJ and the Global Health Law Consortium are trying to do now is to address the gap that we've seen in terms of state responses by ensuring that responses to public health emergencies comply with human rights law. And in fact, to go a little bit further, to ensure that states understand that a human rights compliant response is the best type of response to public health and improves the response to the public health emergency.
The Global Health Law Consortium is honored to work with the International Commission of Jurists, bringing together experts throughout the world in global health law and human rights law to help to craft human rights principles and guidelines for public health emergencies.
The principles we're proposing are much more comprehensive than the Siracusa's because they provide a full range of human rights obligations that the Siracusa principles don't, especially in relation to economic and social rights. Yeah, they see human rights obligations involving positive measures, steps. Yeah, whereas the Siracusa principles are looking in preventing damage and containing rights or justifications for containing rights. We are giving justifications for rights realization in the worst scenario.
The justification of these principles already exists in human rights law. So these are obligations that states have already signed up to. In many cases, these are things that states are already doing. But what we are doing in terms of these principles is to get some of those obligations and really think about how they would apply in public health emergencies.
One of the most unique things with these principles is that we had a very interdisciplinary and we brought in approach to understanding what's a human rights-based policy or what is a human rights-based approach to public health.
It's just the simple brain power and passion in the room, which I really am loving to see. Everyone really cares about health. Everyone really cares about human rights.
So as Kellen, we work with communities, particularly communities that are vulnerable and marginalized. And this process has been useful for us in not just articulating the lived realities, but being able to appreciate that the normative framework can be moved and understood within their lens and their context.
I think the process that we're going through now is exciting in that people from a number of different perspectives are precisely doing that, are reflecting on the lessons that we've learned in COVID-19, but also previous work in Ebola, for example, and thinking through what are the gaps in international law, looking both at global health law, but primarily at international human rights law, and trying to thoughtfully fill those gaps in ways that would be useful to government policymakers.
The idea is that if governments do have some kind of document, some kind of good standards that briefly tell them, well, these are the things that you should think about from a human rights perspective, very practically, when the next health emergency hits, then they're more likely to actually consider those.
We're not only building on existing rights, but we are thinking about how rights might look like in the future. And I think that this is really super important because rights evolve. They don't remain the same.
The major achievement of the principles is that there's a broad enough consensus amongst a large range and variety of experts that there needs to be forward movement in the development of international law when it comes to human rights in public health emergencies.
This is our one shot. It'll never come again for us to really transform global health governance and human rights.
Human rights are almost always the first thing to go during a crisis. But actually what we see again and again is that they should be the thing that stays because they enable communities to have trust in governments. They enable communities to seek health services in ways that are not discriminatory. They enable a wide cross-section of people to think about the ways in which diseases spread. So if we put human rights at the center of our responses to health crises, we will be successful with the next crisis. And so these principles are really important for states as they think about the next crisis.
And if we can take that forward, and if we achieve pushing this discussion, and by the next global pandemic, which will occur, having a better place and states being in a better position to respond, then that will be a significant contribution.